Neurological Part 2. Stroke. A CVA is a cerebrovascular accident. The right side affects the left side of the body, and the left side affects the right side of the body. Be fast. Balance eyes, face, arms, speech, and time. Strokes happen in arteries with a lack of O2 to the brain and glucose. Alteplase can be given if a thrombotic stroke and within time frame to dissolve the clot. A thrombotic is ischemic, can have signs and symptoms in minutes to hours, and a hemorrhagic has sudden onset of signs and symptoms. It can lead to a cerebral edema. Not much we can do since there's not much room within the skull. Focal deficits, ataxia, gait issues, facial weakness, drooping, they can stick out tongue and test hypoglossal, cranial nerve 12, decreased level of consciousness, and sensory loss. Time equals tissue. You can diagnose with a CT scan ASAP to determine ischemic or hemorrhagic. Lumbar puncture can be done, but it's a waste of time and not definitive. Treatment depends on ischemic or hemorrhagic. Depends on the location within the brain. Right CVA affects spatial perceptual deficits, like they can't see the door that they're trying to go through. They minimize problems, short attention span, visual field deficits, impulsive and impaired time concepts. The left side affects speech and language, aphasia, impaired comprehension, slow performance, visual field deficits, and they are aware of deficits, so have anxiety and depression. Causes of stroke, or a CVA: stenosis and atherosclerosis of arteries can be modified. Hypertension, diabetes mellitus type 2, sleep apnea, heart valve disease, myocardial infarction, and aneurysms. They will say, this is the worst headache of my life. It's hemorrhagic. The balance would be unstable gait, ataxia, loss of balance, eyes, vision changes in the pupils, face, asymmetrical weakness, headache will be severe, the arms, sudden weakness and numbness, speech, aphasia, expressive or receptive, time to call 911. This is all a potential for seizures, and a sickle cell disease is at risk for ischemic stroke. It's not modifiable, but you can decrease the risk by making sure the patient is adequately hydrated. They may not die from a stroke, but from complications that arise later. Foot drop and contractures are some complications that can be helped with passive range of motion. Most strokes we see are in the elderly population, but can happen to young people due to congenital issues. Family history of stroke need to be evaluated. About 40s and 50-year-olds, and manage blood pressure and diet and weight to prevent strokes. Hypertension is the biggest cause of a stroke. It should maintain a systolic blood pressure below 130. The patient has 2 to 3 hours to get to the ER once symptom onset to receive treatment if ischemic. Fibrinolytics for ischemic, such as Alteplase. Cerebral edema, you will have increased ICP, swelling in the brain, such as bleeding, infection, trauma, and inflammation. Vasogenic is the most common and caused by stroke, brain tumor, altitude sickness. Cellular or cytotoxic from a TBI or a stroke. Interstitial is from hydrocephalus or meningitis. Osmotic is from metabolic pathologies. Diabetic ketoacidosis, such as an uncontrolled glucose and hyponatremia. It can be to do with the fluid volume status. It can cause brain herniation and brain death. The risks: trauma to head, stroke, ICP, obstructive hydrocephalus, intracranial lesions. Non-neurological risks could be high altitude illness, Rey syndrome, like giving aspirin to kids that will lead to Rey syndrome, lead poisoning, hepatitis. Patient will have level of consciousness changes and sensory alterations, nausea, vomiting, and dizziness. Medication, you can give mannitol, which is an osmotic diuretic. It will reduce fluid volume in the cranial cavity, but will bring it down to the rest of the body, cause diuresis. Labs, you can have a CT, MRI, labs for causes, neurological cause or not. Acute phase neurochecks every 1 hour. Craniotomy and craniectomy all to drain fluid and reduce pressure in the skull. The skull can be put back after it's resolved. It'll be kept in a freezer, or the piece can be put in the abdomen to replace at a later date. Head injuries. TBI is a traumatic brain injury. They need rest and quiet. They will have concussion, subdural hematoma, such as bleeding and bruising. ICP is increased intracranial pressure, increased with brain, blood, or cerebrospinal fluid, brain ischemia, diffuse axonal injury. Watch closely and keep them awake and check neuros or wake them up. If they fall asleep, they might not wake up. The patient is usually one-on-one for a little while until they're out of the woods. The test, you can do an apneic test, which means take the patient off vent for a minute and check their ABGs, or you can try ice water in their ear. They will have a reaction if there's any brain activity. Coup and contracoup. So the coup is when the brain hits the front of the skull, and contracoup is when the brain hits the back of the skull, such as in shaken baby syndrome. The Glasgow Coma Scale is 13 to 15, you would say, is a mild head injury. 9 to 12 is moderate, 4 to 8 is severe, and 3, you can be dead. Causes of a traumatic brain injury can be a motor vehicle accident, abusive head trauma, falls, assault, and it can be blunt trauma, penetration, or a blast. Significant head injuries are most likely lifelong, and it will affect the whole family. Manifestations: physical effects such as blood pressure, heart rate, insomnia, cognitive changes, LOC, and emotional changes. The labs, you can do a CT, MRI, and you can look at the injury mechanism, such as do they need a drug screen. Aneurysms. They can occur in the carotid and vertebral arteries. A saccular aneurysm is a little bulge of the side of the vessel. Hypertension will burst it. Fusiform aneurysm, the vessel is swollen like a balloon. A ruptured aneurysm, it has burst. All of this can lead to a hemorrhagic stroke. The patient might not know that they have it. You can put a clip on it to shrivel the sacula. You can coil or dissect the fusiform. The risks are defects in the vascular system and structural deviations, inflammatory response, degeneration in the elderly. The biggest risk is hypertension. Hemodynamic stress, hypertension can grow it or rupture it, and you can modify hypertension, smoking, and obesity. Non-modifiable is genetic, such as family history, hormones, and sex. Unruptured are often unnoticed, asymptomatic. Ruptured, you might have nausea, vomiting, stiff neck, sudden severe headache. The signs and symptoms are similar to a stroke. For the labs, you can do CT, check electrolytes, and control their blood pressure. Neurological checks every 1 hour and LOC vitals. Elevate head of the bed, keep them in natural positions, and turn every 2 hours. Keep them comfortable with pillows. Keep blood pressure low for safety. The medication you can give are antihypertensives. You need to reduce environmental stimuli for all head injury patients, decrease noise, lights, and anxiety. The head of bed should be elevated to 15 to 30 degrees to reduce ICP and promote venous return. Parkinson's, such as Michael J. Fox has it. The norepinephrine and dopamine both are lost from the adrenal medulla, which controls the blood pressure. The neurons can't communicate properly, the synapses don't work, they can't connect, they can't meet. If it's unknown, it's idiosyncratic. It could be genetic, it could be environmental cause, possible exposure to pesticides or heavy metal toxicity. Signs and symptoms include tremors, slow movement, stiffness, fatigue. You will have to keep the patient safe. They're at risk for gait issues, balance, and fall risk. Comorbidities, they could have blood pressure problems because of the norepinephrine. They need low impact but safe supervision with exercise and decreased environmental stimuli. They lose the ability to do, but they don't lose their mind. They will need speech for dysphagia. There's no cure. They vary in stages 1 to 5. 1 is less severe, 5 is more severe. There is no test to confirm Parkinson's, but you can do labs to rule out other issues. Medication, you can use carbidopa-levodopa to prolong progression of the disease. 1 is mild, 2, tremors bilaterally, 3, mild, mid-stage, mild to moderate, 4 is debilitating, and 5 is maximum assist and bedbound or wheelchair bound. Medications, you can use anticholinergic drugs such as atropine and diphenhydramine. They will dry you up. Peripheral neuropathy. The nerve supply has deteriorated, possibly shrunk due to diabetes mellitus type 2. So the patient can't distinguish hot or cold, sharp or dull, that kind of thing. The myelin sheath is around the nerve. It's a coating such as the electrical wire coating, the plastic around the electrical wire. The causes are demyelination causes chaotic communication and eventually they can't communicate. Multiple sclerosis have periods of exacerbation and remission. Diabetes mellitus type 2 is the biggest cause of peripheral neuropathy. Stress, autoimmune problems, inflammation, chronic alcohol all can exacerbate this, and there is no cure. The labs vary depending on what type of demyelination it is. You can do a NAT test, A1C, ANA for autoimmune diseases. It's very debilitating and it doesn't respond to pain medications. You can try gabapentin, but success is not high. You should not take any medication with antacids and avoid breastfeeding with gabapentin. This was Neurological Part 2, read by me for me, and the notes were taken from lecture to help me understand the topic of neurology. Thank you.